In Oklahoma, Congressman James Lankford, chairman of the Republican Policy Committee, the number 5 Republican in the House. Good to see you, Congressman. Good morning.
Good to see you as well. Good morning.
Well, the Supreme Court has ruled on the ACA. It is the law of the land. Most legal experts say these cases are a long shot at best. Are Republicans grasping at straws here?
They're actually not grasping at straws. It's interesting. You talk about that particular part of the Affordable Care Act has been ruled constitutional on it. There are multiple other arguments that are still going through, including this one, dealing with what's called 1311 of the actual Affordable Care Act. The way that it's written is that it says if you have a state subsidy, if you have a state exchanges, then you have all these penalties and all these taxes and all these things that go with it. If you have a federal, then none of those things are actually included. Well, they didn't anticipate that 30-plus states, 34, 36, depending on how you count all of them, actually are going to do federal exchanges. So the problem is the law doesn't work the way it's written, and so they've just interpreted it to say, well, we assume the law meant to say something else.
Isn't that because Republicans refused to set up those exchanges?
No, not entirely on it. The law gave the option.
Republican governors made a lot of decisions out there to do that. That was not anticipated.
So your anticipation would be that we should have mandated all that and not let states make a choice when the Supreme Court actually said you can't do that. They did rule unconstitutional when you mentioned the Affordable Care Act earlier with the Supreme Court that the federal government can't come in and mandate all these things. It has to be a choice. Those states had that choice. They made a choice. And then the administration said, well, we wrote the law wrong, and so we're just going to shift it. You can't just change the text of a law saying, well, we would have written it a different way if we'd have known you'd have done that, and change it. That has to go through the legislative process. That is something the court should decide. Legislative branch writes the law, executive branch interprets the law, or actually executes the law, and the judicial branch interprets it.
Well, let me ask you about some of the new statistics that are out there. One is that 100,000 people, NBC News has learned, signed up for Obamacare on the federal exchange in November. That's more than 3 times the number in October. Also, spending has grown by an estimated 1.3% a year since 2010. That's the lowest on record. Price inflation is at its lowest rate in 50 years. The slow growth in health care spending has made a big dent in the long-term federal budget. So aren't those all good things?
Well, those would be good things of 100,000 people getting involved, that there weren't 5 million people that just 2 months ago were kicked off their insurance. So 100,000 people signing up when 5 million people lost it is a tough figure to say that's a positive thing. You've still got millions of people that don't have insurance and have had a difficult signing up. And if they don't sign up quickly now in the next 3 weeks, and if the website doesn't work flawlessly now for the next 3 weeks, people that were insured are going to lose insurance in January. If you look at just my district, for instance, I have 1,500 small businesses that all work together in association to create a high-risk pool. Those high-risk pools for small business are now considered illegal under the Affordable Care Act. So all of them are out shopping when they currently had insurance. So again, it's from your point of view on it, whether that's a good thing that 100,000 people signed up when there are millions that still don't have it or have to change forcibly.
Well, according to the Kaiser Family Foundation, for example, Congressman, 144,000 residents of your state will be among 5 million Americans who won't be covered by Obamacare because their states are refusing Medicaid expansion.
Yeah, our state is actually doing something called Insure Oklahoma. If you look at our state, we've done it for several years. It was a ramp-up process where it was a state solution to try to deal with uninsured in our state. That now is also considered illegal, and we're going through the process to try to figure out people that were covered under Insure Oklahoma that are exactly in that pool you're describing now are being pushed out, and our state has to then reconfigure. And the biggest issue is why. You talk to the people that were covered under Insure Oklahoma, they liked their coverage. They were engaged. They've actually come to me and complained and said, why can't I keep this? And so there are big issues on it. So it's simple to look at the data from a distance, but when you know those families face to face, you see the real effect on them. I had a car dealership that's in a very small car dealership in central Oklahoma City just talked to 2 days ago, and his statement was he's now gone back on and has discovered he's losing his insurance because he's one of those small associations that pulled, those small businesses that pulled together an association, and now he has to say I either have to pay more or keep my doctor. But if I go into the exchanges, my doctor's not there, or I'm going to have to pay a lot more. Why do I have to change on this all? What was so bad about my policy and my doctor in the past?
Well, we're going to hear from the president later today with some of the people who have been helped by the Affordable Care Act, and this is a story that will be ongoing. Thanks for coming on and talking to us about it, James Lankford. And we want to remind you